Okay, so everyone, okay, so let's start. So our last and third lecture for this morning. So you today talking about the skin and the structures. So you want to know the depth. Now we want to know about the skin functions, and how the skin evolved. If anything would be a problem to the skin, right? Okay, so why do you think this is important? Because can you imagine? Let's say if I were to give you a picture that the skin is damaged or the skin has failed, right? So before we go to the skin functions, I just want to know how you what kind of picture you have about the skin. Okay, so you can imagine that you always hear about heart failure or a heart is having a heart attack, a heart is damaged, a heart is failing. Oh my goodness, somebody passed away due to heart failure, right? But what if a skin failed? Have you heard of that? Skin failure, maksudnya kulit tu dah tak berfungsi. Apa akan jadi kepada kita? What will happen to us if your skin fails? So you must imagine that the skin is the largest organ in the body, right? Not many people acknowledge that, but it is because it is the widest. If you spread your skin, I think it would be 100 tennis court wide. If you were to spread each and every part of the skin of the body, so it's very wide. Yeah, not to say that you can't see or you can't really visualize. Oh, a heart is an organ structure, but your skin is also a structure where it covers, right? So it's not only that, it has a lot of functions to it, right? Okay. So everybody wants beautiful, healthy skin. Everybody wants fair skin. So when you talk about the beauty world, when people ask you, the common things that people want keep coming to you is, I want to be beautiful. So beautiful is actually subjective, isn't it? Right? So a person of 50 years old may look 30 years old, but a 30 years old may look 50 years old. Sometimes, not an insult to anyone, right? But sometimes you tend to measure by your emotional or your emotional categorization, or by just using a fairly visual acknowledgement, isn't it? So when you talk about beautiful, so it is 50 years old, 60 years old skin not beautiful as 30 years old skin? It's really subjective, right? So what beautiful healthy skin means that it does not has much damage, much pigmentation, much problem in terms of skin problems. So now we're going to talk about what are the problems of the skin, what are the illness of the skin that is pertinent to unhealthy skin. So now you know what is a good skin, what is a bad skin, isn't it? It's very important, right? Not to say what is a beautiful skin versus what is an ugly skin, right? So it's really an incorrect terms there, right? Okay, so you want to slow the rate of aging. So everybody don't want to age. So everybody wants to stay young forever, right? So the technology and the advancement of treatment has allowed us to slow down the aging, not to stop it, and to delay the process of aging, right? Okay, so you want to know, okay, there we are. Coming back to a good old friend, the skin here. Epidermis, dermis, hypodermis, or subcutaneous. So you are well versed with the layers. So epidermis contains 5 layers, right? The most base is the basic layer. The dermis contains, you see here, the nerve, the blood supply, and the soft tissue, all the cells, the pressure cells, the temperature cells, all the main ingredient of the skin. Yeah? I call this ingredient so you can memorize this. So the collagen, the elastin, all the vitamin D production all goes through here and synthesized and stored, right? So as you age, all these ingredients are depleting, including your fat tissue, as we can see earlier from the second slide. And of course, these are all already dead. The first layer, the first few layers of the skin is already dead skin because it's keratinized, right? So your living skin are all the ones below, right? So you want to get in control of that. You want to produce skin by you controlling the amount of skin produced by the controlled injury that we've mentioned earlier, right? Okay, so like I've mentioned, the heart, lung, and liver, okay, covers the area. It's about 4.5 to 5 kgs of your body weight. Okay, so does the skin vary in depth? Definitely yes. Right? Okay, so as you can see, your face, and not all, I do believe that it is documented, not all, everyone in the world has the same skin thickness. For example, those living in cold areas, they have further skin thickness to combat them, to make the skin regulate temperature better, right? Because they need to insulate and they need to retain the heat, right? So those living in the mountains area, those living in Alaska, in Arctic or Antarctic, in Iceland, things like that, places like that do have thicker skins, right? For them to accommodate to the temperature, right? But generally, each part of your face has different thickness. So you imagine your eyelid is only 0.5 millimeter, not centimeter. And your palms and sole is 1.5. Okay, just imagine generally that the most thinnest part is around the eye. So why do you have to know this? It is very important when you want to do eye treatment, right? So you do not apply chemical peel on your eyes because it is very thin. It will easily get burns, right? And pain and swelling and things like that, right? And you don't do lasers on your along the eyes and along the eyes because of all these structures that is near, and because of the thinness of the skin, right? Okay, so renewal of the skin takes place 28 days. It's exactly about 2 weeks, not 28 days to be exact. It's 2 weeks to 120 days, right? Okay, everyone good so far? Okay, so everybody wants to become as young as possible. So when you're baby and when we're little girls, right? Whenever we have, skin damage, you go out when you are schooling, you are exposed to a lot of sun, but your skin is perfectly all right, isn't it? But now, when we go out to the sun for even 10 minutes, 15 minutes, you already have sunburn and you already have the wrinkles. Your skin will become coarse, yeah, and kasar and everything, right? Why it happens? Because of the depletion of collagen in the dermis layer as you age, right? So treasure the little children's skin, right? I always feel the little children feel skin because that's the best they can. So everybody is coming with baby skin products, baby skin cosmetics. Not to say you will definitely come back to that age of the skin, but to mimic the new skin that you'll have, right? So as you age, you can see the wrinkles. Okay, so your skin has a protective layer to prevent water from coming out, to prevent water from coming in, to prevent the harmful substance, the toxins, the bacteria, the fungal, the virus from coming in or coming into your body. And it has a thermoregulation. It controls the heat because at the dermis layer, there's a Merkel cells and Pacina cells that is meant for to regulate the temperature, right? So what happens when you feel hot? Your skin would sense it, and the pores will be open. The hair, the little hair follicles that you have on your skin will be erected, will be straight to release the heat, right? So that's part of the heat. So when you are cold, you need to trap heat. So the hair will go from erect to, it will it will come horizontal to trap the heat, and your blood vessel will thins, right? That's the function of the skin, to retain and release the heat. Okay, so it's excrete. What does it excrete? What comes out from your skin? Ariana boleh jawab, apa yang kulit rembeskan atau keluarkan? What comes out from your skin?
Sorry doktor, ulang balik.
Okay. Apa yang kulit keluarkan? Maksudnya, apa yang kulit rembeskan dan keluarkan dari badan. Okay, what does the skin excrete to avoid or to get rid of something from your body? What? Peluh, yes, sweat, right? So sweat, peluh, it contains a lot of toxins, a lot of it does bring out bacteria in certain cases, in certain concentrations, and it excretes a lot of waste products, right? So excretion. Secretion, it secretes the skin, secrete tu dia rembeskan. It secretes the oil function of the skin from the sebum. Everybody must have sebum. If you don't have sebum, your skin will be totally dry. You'll be like the skin. You look like the moon craters because you need this moist on your skin. You need certain oil that could be released and trap the moisture on the skin to make it moisturized. Right? It's very important because a dry skin would promote bacteria to attack, would promote any allergy to act. Okay, but an over secretion of oil, which happens in acne patients, those with muka jerawat, they have a excessive secretion of oil or sebum that could cause harm to them because oil traps the bacteria. It does not give way for excretion just now. The excretion of waste through your sweat, peluh, dia block peluh, it blocks the sweat and causes bacteria formation and causes acne, jerawat. So that's what happened when this function is impaired. Okay, absorption. Absorption, it absorbs vitamin D, but vitamin D only from 7:30 a.m. to 9:30 a.m. in the morning. The rest is not called vitamin D. It's ultraviolet and causes skin cancer. If you were to sunbathe at 12 noon, you won't get vitamin D. You'll get something else. Okay, so it's very dangerous, right? The amount of sun rays that goes beyond that timing, it is harmful rather than beneficial, right? But the absorption of vitamin D that brings calcium into the bone happens during those times. Sensation, yes, you sense from the touch, you touch something, you feel heat, you feel cold, you feel any movements. So your skin has these functions. It's amazing how skin functions, isn't it? There's a lot of functions. Okay, synthesis vitamin D, I mentioned this now. Okay, so protection. Okay, so like we mentioned, it protects, it is a barrier against bacterial, fungal, and virus and foreign matter. Foreign matter, chemicals. If you were to pour chemicals on your skin, the immediate reaction is just red, right? If there is no skin, the muscles will be shred, meaning to say the muscle will be destroyed. So that's why there's a skin protection. Of course, it reacts to the chemicals, but it is a protective barrier, right? Okay, so sensory, yes, the touch, right? You'll be able to feel the touch. Thermoregulars I mentioned. Okay, so the cooling and the heat, the heat releasing and the heat trapping. Okay, excretion, the waste via the sweat, and helps prevent dehydration. So it does not want to excrete everything. So it has a sensory that if the body recognizes that you need to excrete heat along with sweat, it does it in a controlled manner, not to release all the water inside your body. So that means it does control the water level or the degree of hydration, to prevent dehydration inside your body. Metabolism, vitamin D, okay, for calcium absorption. Okay, now we already talked about layers of the skin. So we're going to talk on this until it becomes your sixth sense. Whenever we call, what are the layers of the skin? This will be asked definitely in exams. The layers of the skin, you must understand, not just memorize. Okay, the epidermis, dermis, and hypodermis or subcutaneous layer. Same goes to the other picture that we saw. Sorry, it's kind of blurred here, but let's see if there is other layers. Okay, let's go through here. Okay, so what we have here. Okay, so imagine the outermost is the dead skin layer, keratin. Keratin is the one that sheds off every day. If you were to sweep your house, and part of the dust is this dead keratin. Okay, dead keratin, and the keratin is that layer. So the stratum, corneum, granular, spinous, and basal. So this is the epidermis. It has 5 layers. The first layer of the skin has 5 layers more. Okay, so along these 5 layers, there's some sensory cells. These are the cells that is involved in combating, in preventing bacterial invasion to the skin. So this Langerhans Merkel cell, it is involved in protecting the skin from bacterial or viral damage. Melanin, I forgot to mention about melanin. So your skin color comes from melanin. So the more melanin you have, the darker your skin is, and the more protective it is towards the sun. Okay, so melanin functions is to combat the harmful UV rays. So we will be talking about the skin types and color by the Fitzpatrick classification. There's 6 classifications, so we'll go through it at the end of the slides. Okay, so the melanin production is at the epidermis, right? So when people want to talk about skin bleaching, skin fair, or brightening or things like that, it's not to stop the melanin production. But somehow the bleaching of the skin or things like that can be harmful where it kills off the melanin, right? When you kill melanin, there won't be pigment, right? So as a result, yes, your skin will be fair, but you are at almost 100% risk to get skin cancer from the sun or any type. You won't have any barrier again. So there are illegal treatment that bleaches the skin to make people look fair, but by dissipating, by ignoring the side effect and major complications, right? So the melanin is very a lot of patients ask me, I want to be fair next week. So I told them, how can you be fair next week? So I saw a lot of people become fair with injections. So some injections is illegal, right? I have not encountered any injection that is legalized by Ministry of Health for this becoming fair or brightening. Again, it's the patient's expectations when you talk. So when I talk about brightening, when coming to two or three level of tones lighter, they were thinking, no, I want to be white. So I told them, you want to be white, you can turn to albino. Albino doesn't have melanin because of they're born without melanin because of the cells are attacking their cells naturally by God's will. But this one, if you induce that, you will have long-term complication of your skin later, right? So you must understand what is a safe practice and what is not, right? You can have bright skin in a natural process. Yes, you can become fair, but not to say to eliminate the melanin totally, right? You don't want to eliminate a normal thing that's been there for life, right? Okay, so everybody okay with this? Okay, so let's move on. Okay, so you have that. We've gone through the epidermis layer. Okay, now you have a layer called basal layer, which is here. So you have the epidermis. Below the basal layer is your dermis. So it's sort of a junction between the first and the second layer, right? It has its own function, the basal layer. So the keratin are formed here. So the starting point of the keratin, the cells, the new cells that's migrating starts at the basal layer, right? By stimulation of collagen from the dermis into the basal layer and goes up, right? Okay, so let's see. This is the formation of the skin. So it becomes rounded cells, right? And it becomes keratin. Sorry, it's kind of blurred again. So it becomes layers and goes up and goes up and goes up and sheds off, right? Sheds off, goes up. Again, the formation comes from basal, a very round cells, and it forms skin from proper skin and from layers of skin and sheds and sheds and sheds and goes up. Yeah. So you are forming the best skin around this area where it is new skins, right? Okay, stratum spinosum. Okay, this spinosum is the third layer of the in the first component epidermis. So it has a lot of layers here. Like just imagine that it is replacing skin by layers. Okay, granulosome is the second. So 3 to 5 layers. Okay, so not I won't go through in depth on each layer. Lucidum is the second layer. You can't really see it because it's lucid, right? Lucid means clear. So it's clear, flat dead cells. It contains precursor of keratin too, where it promotes the skin shedding. So it promotes the skin shedding off, going. Dead skin production. Okay. Okay. Corneum is the most uppermost. So this is 30 layers of corneum. The first layer of the epidermis, right? So this layer is a water repellent. It does retain water and it doesn't allow water to come into your skin, yeah? The corneum. So this is where the water protection barrier is. Okay, so it also protects against light, heat, water, chemical, and bacteria. This is very important first layer. Okay, so keratinization. So this keratinization, let's come back to this photo. It's not really clear, but okay. Imagine keratinization is the production of keratin. You don't want much of keratin because keratinocyte will shed off. However, you want the skin to go through that process to sustain the strength of the skin and the new skin structure, especially in the corneum up to the spinosum. So you want that. You want this to happen. So it does give you a strength and durability to your skin, the new complexion, the brighter complexion, or any other desired skin changes, right? So, but the desired skin changes as you age or as the damage comes from the sun, if you don't apply any sunblock, the keratinization will happen at a faster rate, right? So the new cells come out, dead and comes away. The new cells comes and again damage goes away. So you do want to prevent that by using sunblocks, okay? All right, so that is the skin border. So nutrient and oxygen goes through these layers from epidermis to the dermis. Yeah? So keratinocyte, we've talked about that. Okay. Okay, so keratinocytes is 90% cells of the epidermis, right? So the keratin, the keratin protects the skin from the heat, the water, the bacteria, and everything. However, it dies off, right? It dies off on the topmost layer and goes out, and new keratin happens. So that is happen every 2 weeks to 120 days. Okay. All right. Okay. Now we talk about the skin pH. Okay. Have you ever come across a product called pH 5.5? Can you recall that? Johnson pH 5.5? Why is it called that? So it promotes the healthy balanced skin, right? So 5.5 starts here. So actually, 7 is a neutral acid layer. So above 7 is alkaline, below 7 is acidic. However, the skin has to be slightly acidic at 5.5 to 6. That's a normal skin pH, right? Okay, so if you were to have acne prone area, oily skin, your skin is acidic and falls below the pH of 4, right? So that means the product in the in the pharmacy, the product over the counter, the skin products that encounters acidic skin has to be alkaline a bit. So does that make sense? Because you want to bring that pH a little bit up until it has a 5.5 or 6 pH as much as possible, right? However, if you have too much of product, certain skin products, too much of chemicals inside, that's why your skin can dry, become sensitive, become red, become irritating, become painful, become pedih and things like that, right? So you have to be careful on the products that you use in the market, right? Okay. So,
Me.
yep, yesterday.
Um, if I have client with hair face with acne, my treatment or my facial can be alkaline.
It can be, but it has to be suitable to the oily type of skin. It can be alkaline, but it has to be at the right concentration.
Okay.
Okay, right. Okay, so any other question from the floor? Okay, everybody okay? Right. Okay, so we talk about acidity of the skin, right? So how about when you talk about combination skin? So it's oily and normal. So oily or normal or dry normal. So that's a combination skin means it's a combination of normal plus oily or normal plus dry. Can never be normal, oily, and dry at the same time. Can never be like that. Okay? So it's either that. It's either that. So you have to understand which pH does the patient falls into. Please advise the correct skincare or makeups and things like that. So if a patient were to have normal oily skin, you can give them normal skin product, or you can use the acne range skin product, right? So if you have a dry skin, so you use the hydration skin product that contains more moisturizers inside, right? If you use moisturizer on oily skin, you will create more harm. That is very important when you want to advise your client or your customers on what are the skin products that he or she have to use after your treatment, right? Even sunblock has its own complexion. You have the cream complexion, you have the gel complexion. So if your skin is oily, you give the gel, because if you give the cream, it will become more oily. It will create more sebum and more trapped sebum and causes more acne. So it's very important on the selection of the skincare. All right. Okay. All right. So, okay, certain acids, it has a bactericidal effects, right? So that means certain acid can kill bacteria. Some of the treatment for acne we have is mandelic acid, right? It's not to say that you need to have too much of alkaline, but mandelic is a lower pH acid, higher pH acid that could kill the bacteria. So when the bacteria is killed, the skin pH automatically increase to a higher level, right? So that's what it means. Okay. So everyone okay? So pH is disrupted by a lot of things, right? So if the skin is alkaline, dry, keratin fibers can shed off more. So dry skin, more flaky, right? What is the flaky? That's the keratin. So you must remember that. So keratin fibers loose and goes out. Yeah. So dry skin, keratin sheds. Okay, so when the pH of acid is become alkaline, okay, so alkaline usually from soaps, okay, so the skin is dry, like I mentioned, so infection, bacteria can come, water is lost, so dehydrated, more dry, more rough, more irritated, more red, and flakes and sheds off, yeah. Okay, so you talk about skin color now. Okay, this is a patient, a photo that we have. So she has the vitiligo. This is an autoimmune condition where her cells attacks her melanin. So this is not related to sun exposure, not related to product. This is a normal condition. So when we talk about skin color, everybody in the world has different skin color, but more or less falls under the same category. So let's say the Fitzpatrick. Sorry. Oh, we're not yet in the Fitzpatrick. Okay, never mind. So we mentioned about the melanocyte earlier. So the melanin, remember in the epidermis, let's go back. Okay, where is a good friend there? The melanin is a production of the pigment component from melanocytes. It's in the spinous layer of the epidermis. Okay, so let's see what it does. Okay, so sorry about that. Okay, so let's see the melanin. Okay, the melanin is the production of the pigment. Okay, so it protects against the harmful UV radiation. So the darker the skin, the more protective you are against the skin cancers, basically, because UV radiation damages the skin and causes skin cancers and other skin changes, right? So the melanocyte and melanin, again, is blurred. It wasn't blurred when we portrays on the slide in class, but it's okay. So never mind. So the UV light will cause redness of the skin, right? And if there is melanocyte, it doesn't transfer the UV rays into a change that could alter the genetic of the skin to become the cancerous skin cells. All right, so that's what it does. Okay, so the fair people, like maybe Yuli, maybe from Puerto Rico, you have fair people, so you easily get sunburn, right? Darker people, like in African people, in African American, in that population, they have less sunburn because the melanin protects them from that. Okay, so now we go to the skin color. Okay, so you want to know, when a customer comes to you, first and foremost, you have to know which category of skin color he or she belongs to, right? Okay, I will come back to this again. I'm just going to go to skin color. Okay, there we are. So you have skin types according to your color. Okay, this is not actually skin type, it's skin color, because skin type is the normal combination, dry or oily, right? So you have Fitzpatrick. Okay, Fitzpatrick skin color type. Okay, so this is the name of the scientist that creates, the dermatologist that creates these classifications. So you have type 1, type 2, type 3, type 4, type 5, type 6. Okay. So the fairer you are on type 1 to type 3, the higher you are easily burned or sunburned. Burned from the heat treatment or sunburned from the direct sun damage. The darker your skin tone, type 4, type 5, type 6, the lesser you are to get a sun damage or burns. However, the higher the hypopigmentation is. Hypo means your skin can be maltoded. There is white patches, so there's fair patches, there's dark patches. There's fair patches, dark patches, because it happens. Later we'll go on to what type of illness causes this, right? So remember Fitzpatrick, okay? All right, so let's come back to the melanin. Okay, don't worry, there's not much left, but I'll try to make it as simple as possible. Okay, so what creates melanin? So the more sun there is, the higher the melanin needed. So your skin will produce more melanin. That's why those in Africa, they tend to have more sun, or those at the equatorial line, yeah, in tropical countries, they have more melanin to protect them, right? So melanin stimulating hormone is a hormone that creates melanin. It can be due to cancer. Some cancer causes secretion of melanocyte stimulating hormone. So the skin tends to be dark, even in people who's not exposed to sun. So you want to further investigate taking the blood and testing for this melanocyte stimulating hormone, right? So ACTH is another hormone, adrenocorticotropic hormone, that causes skin darkening. So let's give an example of if a patient have not thyroid, the other hormone called Cushing syndrome. I'm not sure whether you've heard of this. However, there's a problem in the adrenal gland in the brain where it secretes this ACTH and melanocyte stimulating hormone. So that tumor in the brain causes increment in this hormone, and the patient has dark skin, but not on monotonous basis. It will be patchy, right? So you want to know what's wrong with this patient. Would we want to investigate for tumor, in brain tumor? So you want to send this patient to for referral to doctor, and for doctor to reassess, right? So don't do any treatment on skin that you feel may have some abnormality as not due to sun, right? High estrogen and progesterone. Yes, this controls the skin color, but not on major basis. Okay. So melanosome varies according to race, I mentioned, and the female or male. Okay. So Langerhans Merkel's touch, okay, is under the epidermis. Okay, the other function, okay, we've gone through that. Okay, we've gone through this, the dermal epidermal junction. Okay, so now let's go to the second layers of the skin. Most important, the one that you are targeting on almost all your treatment, because it has collagen, elastin. So you want collagen, collagen, collagen. So you want any process of the treatment is called neocollagenesis, new production of collagen. So you do want to stimulate this layer in the dermis, the second layer, right? Okay, so it does contain hair follicle, gland, nerve, blood vessels too, as it goes along to the third layer. So it is a vascular layer, meaning it has a lot of blood vessels, right? So thickness is about 4 millimeter, and it has two major regions of dermis, the dermis and hypodermis. Okay, but generally we say the third layer. So let's see, this is the thickest layer. If you can compare, this is the dermis, epidermis, and dermis. You see a big chunk of the dermis is here, the thicker layer, right? And the subcutaneous layer contains the other, the continuation of other structures. So you have hair follicles, you have sebum, the one that secretes your oil to the skin, sweat gland that brings out your sweat, okay? Some of the blood vessels, the sensation cells, a lot of things is inside. Very important. It's most important for us, the aesthetic practitioners. All right. So the dermis, another term for the first layer is papillary and reticular, but you don't need to remember that in terms of separation of the dermis. Just remember its dermis is good enough. So the topmost dermis is like a dermal papillae that joins dermis and epidermis. That's all. Okay. So it has a lot of structures in the dermis. The sensation cell, the nerve cells, the touch cells, right? Okay, the reticular dermis is the most condensed, means the deeper dermis contains a lot of collagen fibers, right? And a lot of other cells and appendages. Appendages is like connective tissue. It attaches one cell to another. Okay, so here we are, very beautiful young skin, all tight and fair. So nothing, no wrinkles, nothing. All the collagens are working fine. stretches very well. Let's see the old skin. Yeah. So all the keratin, all the collagen is on the right place. But you see, in older skin, collagen is depleted, is breaking up, right? And as a result, it collapses. When it collapses, it creates these wrinkles, right? So the degeneration, the collapse of the dermis layer creates this wrinkle, all right? Okay, so fibroblasts, the cells that produces collagen. So here we are. So as you age, so everybody wants to look to the left, not to the right. Okay. So you see, young skin, collagen is tight. Old skin, collagen is loose. More collagen, definitely less collagen in old. More blood flow, lesser blood flow. So the cell turnover is longer. It sustains longer in young skin, but in old skin, it slows down and it shuts off, but it doesn't replenish as fast as the young skin. Yeah, that's what it means. Okay. Blood supply. So blood supply to the skin brings up food and nutrients, oxygen, mainly oxygen. Okay, so appendages, skin has a lot of organs too, sweat glands, touch, the hair follicle, all these other, we call these appendages or the friends of the skin. Yeah? We mean to say the other components inside the skin. So the Fitzpatrick, okay, so right, so you see here, 1, 2, 3, the most fair. So maybe Europeans has 1 or 2, or those living in very cold countries. So they have, because they are fair, they have freckle skin that is visible, right? Okay, it always burns because they are on the fair. It's easily seen because there are less melanocytes. So always burn, coming down to usually burn, coming down to sometime burn, rarely burns, very rarely burns, and never burns, right? Okay, so the skin color, white, white to olive, brown, dark brown, black. Okay, so roughly when a patient comes to you, let's say a patient is on a darker skin tone, 5, or most Malaysians is only at 4, 5, 6, right? So when we have a Chinese lady, maybe 3 or 4, so you must know that the length of the laser machine shouldn't be the length and the duration of exposure of certain energy machine shouldn't be the same as the one for the the darker skin tones, right? So the longer your energy is given towards a fairer skin, the more it burns, right? However, not to say you can expose more heat to the higher, but you must always use within the wavelength, but with appropriate exposure. Meaning to say, even if you exceed by accident, that you'll be safe because the skin won't burn. But you don't want to do that. But you just have to be extra careful with the fair skin. That's what it means, yeah? Okay, so everybody okay with Fitzpatrick? All right, good. Okay, so again, it's the same. So here, you need to, your age, skin looks visibly different, location of the organs and location of the thickness of the skin, the type of the skin we mentioned, the normal, the combination, the oily or the dry, sun damaged skin, layers of the skin, pH you know about, especially when advising on the products. Ask about the previous treatments, very important. Previous outcomes, what happened to the treatment. Let's say if he or she were to go to clinic or beauty salon center ABC, what happened to the skin? Is it better? Is it the same, or has it become worse? You can actually ask that, and you can actually ask the client to show. Can I see a photo after you had those treatment back then, right? So you want to know, is the skin more prone towards damage or not, right? For you to be careful in your treatment. So, all right, we've come to the end. So thank you for that. So now I open the floor to questions. not just on this topic, maybe from the first topic that we come across, the invasive treatment, the facial anatomy, and also the skin anatomy. So, any question from the students, please? Okay. Kirtana, you good?
Yes, Doctor. Good.
Okay. Any part that you don't understand?
No, everything understood, Doctor.
Okay, good. Yuli, you good? Are you okay?
Yes. For example, in my country, we have beach all around
Yes.
us.
Yes.
The people is
Puerto Rico is Central America, right?
this is a Caribbean island.
Oh, Caribbean. Wow.
Yes.
I would love to go there. Nice beaches. Right.
Yes. So the people is exposed a lot in sun,
Yeah.
and sometimes they use
Sunblock.
products for example from China or from this part of Asia, but not really, not all time is for this type of skin.
Understood.
Yes. Is the same for hair, is the same for all products. Can we need be more careful about the ingredients.
True.
So if we live in the sun, in the salt water, the humidity and all, what kind of product can I recommend, or what which ingredient cannot be able for this type of
Skin.
weather?
Okay, so for those areas in parts of the world that has high sun exposure, so a strong sunblock is of importance. Number one, the SPF needs to be more than 50. Cannot be 30, cannot be 40. It's not enough to cover the skin from the UV. The UV rays, for your information, we have two very harmful rays, UVA and UVB. UVA damages the dermis layer, the deeper layer. UVB damages the epidermis layer. So if you this is a good homework for you all to do. Go to the pharmacy and see the sunblock that they have on the shelf. So you try to see some sunblock only has UVA. Some sunblock only have UVB. However, you need both. Most sunblock that has UVA, UVB is expensive, meaning maybe in Malaysia about 50 ringgit or more. However, I do recommend that if you can get a medical graded sunblock. So we aesthetic physicians, we don't like to use the over-the-counter sunblocks because we know that some ingredients are missing and it's not giving a full coverage for the patient. So if we were in hot countries, tropical like us, in Puerto Rico, in Caribbean, in Africa, you need SPF 50 and more. So number one, and you need the sunblock to have UVA, UVB, both, not either one, right? And a medical graded sunblock, there are a brand called HelioCare. Where can I type that? So HelioCare, let me just type that in the chat box. So HelioCare, it is widely available, right? So it's widely available. You can buy it in market. I do have the name, the contact of the supplier. If anybody would want that, I'll be happy to give it to you. So this is my number. You can ask me any question, not a problem. So I'll send my number. If you need the contacts of the supplier, please take my number and let me know. I'll be happy to share. So you can buy in Shopee, in Amazon, or maybe direct. I think it's from Spain. So you have another sunblock, medical graded sunblock. So where can I write this? Medical graded sunblock. Okay, so it means that it is most used by doctors to patients, right? So the pharmacy or over-the-counter sunblock is not really medical graded, but you can use as long as it has the other components. So I saw that Neutrogena has those criteria, but I fail to see that the others has. So sorry for that. I'm not here to promote any brands, but from our understanding and from my clinical practice, we do advise this. There's another brand, medical, called Freeziderm. So I'm sorry, I don't have the Freeziderm representative, but you can find that online, and maybe you can put that in your beauty centers and advise the patient to take it, because it does last long. One bottle has, I think, can last 3 to 4 months. It is a very good buy. It's not that expensive, about 100 plus, but it gives you coverage, especially after any treatment, be it a facial. So please advise all the patients and clients, any treatment that they come to you, they must have these two, moisturizer and sunblock. So come back to your question, Yuli. So other products, moisturizer is needed. Of course, you can advise and educate them not to buy things from China without knowing the ingredients. And I do have some suspicions that it is those I'm not sure it's a sunblock or a bleaching ingredient that can reduce the melanin production, right? That's very dangerous actually, because we do understand that people want to become fair or white or whatever that they may have assumed in their mind fast, right? So advise and educate them to stop using some that you do not even know the ingredient, but come back to the normal things that you need, moisturizer and sunblock. So I usually advise all my patients, if they have dry skin, to use moisturizer twice per day or more, morning and before they go to bed. And if they have normal skin, maybe once, or if they can use more. Moisturizer can be of any brand, does not matter. But sunblock, I'm very particular on having this particular criteria for a sunblock to be used. Right.
Those products those are international or
international? It is
international.
International.
So I can actually I can move to Puerto Rico and I can buy.
That's right. Can.
Okay.
You can find this supplier. I'm not sure in Puerto Rico, but initially maybe you can go to the website. So the HelioCare website and the Freeziderm website. So it's from Europe. So you can email them and ask them, can you be a supplier, or do they have a nominated supplier at your country? I believe they have, but if you don't, it's your golden opportunity. So you become the first Puerto Rican supplier for this sunblock. You'll make money. You'll make very big money. So it's very good.
Yes.
So we do have in Malaysia, we have only one representative, but you can buy it from Shopee, from Amazon, but Amazon has more expensive because of the postage. But if you do want to try on your own, it's no harm, right? It's very, very good, right? Okay.
Thank you.
Welcome. Okay, Ariana, ada apa-apa soalan nak tanya?
Doktor, saya nak tanya sunblock dengan sunscreen. Okey, sebenarnya mana yang terbaik? Ada yang saya dengar kata sunscreen ni dia macam menyerap haba.
Oh, okay.
Ini jadi saya perlukan penjelasan antara sunblock dan sunscreen lah.
Okay, baik. Okay, so Ariana was asking what's the difference between sunblock and sunscreen. Okay, I'll do that in two language. Okay, so sunscreen ni kadang-kadang dia adalah misnomer tau. Kadang-kadang dia sebenarnya sunblock. Tapi nama lain dia sunscreen, sunblock, sun protection, sun cream, semua benda boleh. Sebenarnya, tapi kalau Ariana tengok dekat ni, dekat farmasi, dekat kedai-kedai ni lah, Guardian, Watson apa semua tu, dia punya term je berbeza tapi fungsi dia sama. Dia taklah bermaksud dia serap haba, bukan bermaksud dia serap haba dan haba tu pergi ke kulit. Serap haba bermaksud serap UV light. Itu adalah haba dari pancaran matahari. Itu maksud dia. Dia menyerap UV radiation. Itu pun adalah sejenis tenaga yang matahari keluarkan yang kena pada kulit. Okey, so itu bermakna serap haba bukan serap haba dalam erti kata serap dan haba tu terperangkap dalam kulit dan ada pada kulit lama, tak, tetapi dia menyerap radiation UV, radiasi UV. Itu adalah sejenis haba. Okey, tapi tetap sunscreen ke apa ke tetap kena tengok dia punya kriteria UVA, UVB dan SPF 50 tadi. Okay, alright, itu satu. Okay, I'll translate it further in English. So Arena question was, what's the difference between sunscreen and sunblock? It is a misnomer that any product in the market can use the same term with for the same thing, right? So it can be labeled as sunscreen, sunblock, sun cream, sun protection, sun whatever. Okay, so these are the terms that can be used, but it is for the same product with the same purpose. However, if it doesn't mention sunblock, although it mentions sunscreen, you do need to see that criteria whether UVA, UVB, and SPF 50 is inclusive inside the cream. Yeah, inside the cream. Some is cream, some is gel. Now sunblock, we have the latest sunblock that we have is in tablet. Makan ubat makan, ada sunblock makan. So we do have Heliocare sunblock tablets for those who are exposed to sun on more than exposed to sun more hours of the days. For example, engineers working at site or those working by the beach, by the sun exposed areas that they need to take more protection, they can take the oral sunblock not alone, together with the cream sunblock to apply on their skin, right? So you do need to see what kind of job they do or what kind of how long is the exposure of the sun. So bear in mind that all the products in the market, be it the terms is has a variety of terms, but it does comes to the same point, same aim, and same projection, which is a cream to apply on the skin, right? Just because it is no point if you were to buy a sunscreen but only has UVA or UVB, but you've been using it religiously, but it does not give function. Your skin still darkens and there's pigmentation, means black spots, despite your using. So it's a totally waste of money, right? Because it does not serve the purpose. You buy, you have spent money, but you still get the sun damage. So this doesn't serve a purpose, right? So I don't see that. It's a good.
Excuse me.
Yes.
Excuse me, doctor. For example, in my case,
yes,
when I went to the beach, I used sunblock plus 80.
Oh wow! Okay.
And after that, my skin became dark. But after maybe 5 days, I can see white points. White points.
Okay.
So, and then after 2 weeks, that is normal again.
I see. Okay. So when you have excessive, you have more than SPF 50, the highest I saw is SPF 100. I've seen that. Okay. It does not mean that it has more protection. Even if you have more SPF, the function to prevent the UV rays is still the same, right? It's just a matter of it has more chemical, because sunblock uses skin chemicals to prevent the UV rays from entering the skin. So it just means that but it does not offer you extra because you only need 50. So when even you reach that percentage that has 50, is good enough to protect the skin. So if it has more SPF, it does not give any effect. It just gives the same effect, same protective agent. It's just a matter of more chemicals inside the tube only, the solution. So the white skin patches that you have is not from the sunblock, it's from the skin damage that the skin is trying to replenish or to heal your burnt skin. So part of it is hypopigmentation, so it's called white. Hypo, not hyperpigment. Hyper is the black or darkening of the skin, but hypo, HYPO, is the whitish or the lighter skin tone that you have as a result for your skin to recover.
Okay.
Okay, right. So basically, you can buy, but it does not have. It's the same effect as SPF 50. But if you bought SPF 30, it's not good because it doesn't have that the right protection for your skin. Right.
For my son, I bought 100.
Oh, for the kids.
Yes.
Oh, no need.
because we are, I don't know, after 30 minutes, play in the pool.
Yes.
Ready. We are.
It's all worn off because of the water.
Yes. Yeah. This is very, very fast.
Yes.
I saw people, I don't know, roster in the under sun all day in the beach, and these people never burn, never feel pain. I feel pain sometimes.
Yes.
Yes.
Because it's heaty. Yes. Because again, it depends on the skin thickness. Some people vary in terms of that. Some has slightly more melanin than others. So it really depends on individual and how much exposure you really have to measure. This is hard to do. Measure the duration of the exposure and the duration where the sun falls on multiple surface of the skin. So that's something that's very hard to measure.
Yes. And my son and I, when this happened, we can see the skin is darker, but my husband become like a tomato.
Red. Yes.
So
does your husband and your son has the same Fitzpatrick skin type?
Yes. This is similar. I don't know if my son is more strong. I think so because me or because I or my race. I don't know.
Maybe because of the age, skin age, like here, age, right? So some skin, like children's skin, they have better tolerance towards the damage. So because the collagen is more, their hydration is more, and compared to adults. So I believe that I think there should be a research paper on how the younger skin versus the older skin react to certain harmful substance such as the sun or any chemicals. So I think that there should be a reason behind the age of the skin. Okay, right. So Ariana, ada soalan lagi?
Ada satu je.
Boleh.
Pasal yang lapisan kulit tu, saya nak tahu lapisan kulit untuk kulit berjeragat.
Okay, right. Okay, so when talking about berjeragat, jeragat is melasma. Melasma is a hypopigmentation, very common skin problems on the skin. So melasma is can be terlebih melanin, overproduction of melanin, plus the damage is at the dermis because dermis and both layers can involve for melasma, for hyperpigmentation. So jeragat ni dua-dua boleh. Epidermis boleh, dermis pun boleh. So kita kena tengok selalunya for melasma it happens because age, because of hormone. So hormon estrogen dan progesteron tu memberi kulit warna yang gelap. Jadi sebab tu ada orang makan anti hormon bila dia menopause, dia makan ubat hormon, hormone replacement therapy. So when a person goes through menopause, they get the darkening of the skin, melasma. It happens in aging people. So the treatment is definitely not lasers or anything. So you do have to assess whether they are post-menopause. So after menopause, usually the gynecologist give hormonal treatment. So not to say it will get rid of the melasma. It's very difficult to get rid of the pigmentation, but it reduces the tone. So at least it's not that visible. But I believe melasma jeragat is a very difficult, challenging skin for us to treat. You can try, but melasma has to be a treatment in combination. Cannot be one treatment alone. So orang yang ada masalah skin yang banyak, so multiple skin problem, do not give them a single type of treatment. Has to be multiple. So sunblock oral or maybe some brightening skin tablet. We have oxycodone, we have crystal tomato, if you have encountered that. So you can give them a chemical peel plus lasers, but not together. So it has to be multiple approach of treatment, not just one single treatment. It doesn't solve the melasma. It doesn't and it doesn't do much, right?
Lagi satu ni doktor.
Okay.
Itu yang macam yang doktor cakap yang macam orang yang berumur lah kan.
Betul.
Okay, macam I punya anak perempuan, umur baru 12 tahun. Tapi dia dah ada jeragat banyak tau dok.
Oh, okay.
Jadi orang pun kadang-kadang kita beautician kan, kita keluar, mak beautician, tapi anak muka bertapuk-tapuk gitu macam, apa benda sebenarnya tu doktor tu?
Oh, yang tu for that kena tengok betul lah Puan Ariana. So kita kena tengok, mungkin bukan jeragat, mungkin kulit dia sebum pores kulit tu tersumbat. Mungkin saya ataupun doktor-doktor lain boleh tengok dengan dekat. So kita tak boleh kata, selalu jeragat memang tak berlaku pada usia muda. So mungkin bagi saya orang kata apa, sesuatu pada struktur kulit yang lain. Bermakna mungkin sebum kelenjar peluh tersumbat, mungkin juga kita tengok kulit dia nipis sebab apa sebab kan. Itu kita boleh nilai lagi. Tapi memang kena jumpa doktor.
Something like blackheads, whiteheads, doctor?
Yeah, can be a blackheads also, but here because some pigmentation is an inflammation of the skin, right? So sometimes bila pores is blocked, the skin inflame and causes the darkening. So bila pori-pori tersumbat, kulit radang dan kawasan keliling kulit tu gelap sebab radang tu. Jadi kita kena tengok kulit tu dari dekat. Kalau dapat buat skin assessment, kalau pergi beauty center kan, dia ada mesin yang tu kan, yang yang you put your face inside the facial analyzer and you can see apa struktur kulit tu, apa masalah. Is it pigmentation tu kawasan mana? Itu semua kita boleh tengok kat situ. Itu cara terbaik lah Puan Ariana, kena tengok dari situ. Dari situ try tengok, jumpa doktor, buat assessment yang facial analyzer tu. Mungkin dia ada sebab lain, bukan definitely bukan jeragat lah, sebab jeragat.
Jadi I ingat mula-mula dia macam faktor keturunan sebab macam arwah ayah kan dia banyak jeragat kan. I tak jeragat. Jadi I ingat macam mungkin dia ikut arwah ayah dia lah, macam itulah.
Mungkin masih awal untuk diikut genetik kan. Selalunya genetik kulit tak ada terlampau awal, 12 tahun ke awal lagi. Mungkin kalau ada 25 ke atas tu mungkin kita boleh cakap sebab genetik kan. Tapi kalau tu terbaik puan bawa lah. Mungkin dia ada chronic allergy ke, kadang-kadang kita tak tahu. Chronic allergy disebabkan hama ke apa ke kan, persekitaran yang menyebabkan kulit tu radang. Jadi itu semua kena tengok dengan lebih dekat struktur kulit tu.
Okay, thank you, Dok.
Okay, welcome. Okay, Syahira nak tanya pun boleh. Asma ada soalan? Asma ada tak? Kirtana, do you have any question?
So far, no, doctor. If I have anything, I can message you.
Can. Okay.
Thank you,
All
doctor.
right, thank you. Okay, if there's no other questions, okay, I hope you you all do benefit a little bit from all 3 lectures on my topic. Don't try to memorize everything, but try to understand the concepts. If you understand this, that's it. Your session from the beginning of ProCat till the last would be smooth and easy. So I'm trying to deliver the concept so you all understand. And from the understanding, you can memorize for life. So that's my aim. So I do hope you benefit from this lecture. If there is any shortcomings or wrongdoings, I do apologize. Minta maaf kalau ada kekurangan. Dan selebihnya tu harap dapat manfaat selebihnya lah. So if feel free to ask us a question. You can go through my number or through the organizers. And for that, I wish you all the best and hope to see you again in some other lectures or trainings later. All right. Okay. Thank you so much for joining. It's been a pleasure to meet you all. And I'll pass back to Shubha